I think we should be live. I'm just getting a final confirmation on that. Yep.
Perfect. Thank you.
Good. So I've got the go-ahead from our backend team. So it looks like everything is okay. So here we go. So hello and welcome everyone to another engaging session of the Organic Majlis. The topic today is health and wellness trends, capitalizing on the growth of organic movement. I'm your host for the day, Shinu Pillai from GL Exhibitions, organizers of the 23rd Middle East Organic and Natural Product Expo in Dubai, scheduled to take place from 17 to 19 November at the Dubai World Trade Center. The Organic Majlis is the Middle East online community of exporters and importers of all things bio, natural, and organic. The GCC health and wellness market is entering a new era of growth, driven by rising consumer awareness around preventive care, holistic lifestyles, and sustainable well-being. From functional foods and nutraceuticals to digital health and traditional therapies like Unani and Hijama, the demand for natural, ethical, and culturally aligned solutions are accelerating. A youthful population, increasing lifestyle-related health concerns, and government initiatives promoting wellness are creating immense opportunities for global brands. In today's masterclass, we are joined by leading healthcare providers, importers, and wellness innovators who will share valuable insights on market readiness, regulatory developments, consumer behavior shifts, and strategies for successful expansion in the region. So without any further delay, allow me to introduce our esteemed panelist. So first up, we have Dr. Priyanka Sainani. She is a DHA licensed physician and entrepreneur with over 15 years of experience dedicated to advancing health and wellness through a comprehensive preventive approach. Known for her impactful work addressing metabolic health issues and mitigating lifestyle diseases, Dr. Priyanka has transformed countless lives by empowering individuals and to adopt sustainable, positive health behaviors. With a strong focus on community health and wellness promotion, Dr. Priyanka founded Huga. Did I get that right?
Absolutely.
Brilliant. So designed to make healthcare more accessible and proactive. Her vision is to remove barriers to healthy living, especially the no time mindset, by integrating technology to support a healthier, longer life for people in the region. Committed to reducing the burden of preventable lifestyle diseases, Dr. Priyanka is focused on driving meaningful change in healthcare and fostering a culture of wellness that supports sustainable health and longevity for all. Welcome once again, Dr. Priyanka.
Thank you so much. Thank you, Shinu. It was a wonderful introduction. Very warm. Thank you.
Thank you. So next up, we have Dr. Sana Atif, Unani medicine consultant and hijama practitioner from Recovery Hub Medical Center, Dubai. With over 15 years of clinical experience, Dr. Sana Atif is a seasoned expert in holistic healing and traditional medicine. She has been a part of the MOH examiner panel for the TCAM, that's Traditional Complementary Alternative Medicine Licensing Exam, as well as a joint secretary for EUDA, that's Emirates Unani Doctors Association. For the past 7+ years, she has been serving the UAE's local population, especially Emiratis, through a unique blend of herbal therapies, cupping, that is hijama, and personalized lifestyle counseling. Her integrative approach combines centuries-old Unani principles with modern wellness insights, addressing the root causes of chronic ailments and promoting preventive health. Dr. Sana is a passionate advocate for the revival of traditional medicine in modern healthcare systems and is deeply involved in community wellness education, making her a key voice in the growing demand for culturally rooted, natural healing solutions across the GCC. Welcome, Dr. Sana.
Thank you so much. That's what a wonderful introduction. Thank you so much.
Pleasure having you. And finally, we have Dr. Sanjay Vyas, Vice President of Sales and Regulatory Expert in Leaf Healthcare. Dr. Sanjay Vyas is a seasoned healthcare professional with over 15 years of experience in regulatory affairs, product launches, and market access strategies across the pharmaceutical and wellness sectors. As Vice President of Sales at Leaf Healthcare, he plays a pivotal role in introducing compliant, high-quality health solutions to new markets. With a PharmD, that's Doctor of Pharmacy background, and a strong foundation in global regulations, Dr. Sanjay is known for bridging the gap between innovation and execution in emerging healthcare ecosystems. His deep insight into Middle East and North African regulatory framework makes him a valuable voice for brands looking to expand in the region. My God, that's a very illustrious intro that I had for all of you. So we are really lucky to have all of you spending your time. We understand that you all have a busy schedule, but as I said in before the intro, we have got over 200 attendees probably from across the globe who is very keen to get into this market. So your insights, your feedback, your advice is really appreciated in this session. So just about the format of today's session. So what we have done, we have accumulated all the questions from our attendees, and we have broadly classified into 5 different sections. And of course, we'll kind of like 2 to 3 questions in each of the sections. And of course, I'll pose them to whoever is expert in that area. And of course, others, please feel free to jump in. Yeah. So I think we'll start with the market entry and expansion. So probably one of the most asked questions everybody want to know is, what are the most common challenges international wellness brands face when entering the GCC market, and how can they navigate them? So I think probably looking at the expertise that Dr. Sanjay has in this area. Dr. Sanjay, do you want to start off? What are the challenges that international wellness brands they face when they try to get into the GCC market in general?
Certainly. First of all, Mr. Pillay, thank you for giving the good introduction about myself. Yes, I will straight away jump into the question that you have asked, and many people would like to know. Middle East is the fastest growing economy and the place and people with high spending capacity. So in the wellness, there is a huge potential for the product to be introduced and to be marketed. I sometimes feel from different across the globe, companies, they don't have proper documents. That makes us little bit delay in doing the process of registration. Otherwise, if the company gives all the documents, I will just take quickly through that, like certificate of analysis, certificate of ingredients, pre-sale certificate, and rest of the documents like WHO GMP certified products. When I ask sometime,
I think
I'm sorry about that.
You're back.
So,
Yeah.
I'm so sorry. So the challenges that is being faced by the companies locally is when they ask for the manufacturing companies to give the different documents, and those documents has to be legalized by the local authority. Now, this is not happening. That's why it's finding it difficult to put the product inside the Ministry of Health or from the Dubai municipality. Apart from that, there is also the language barrier is there. Sometimes it is in different language. It could be French, it could be the rest of them. So we always tell the manufacturer that you should have it in English, which is normally understood by most of the people, and also you can have it in Arabic. Now, sometimes they find it difficult to put it in Arabic. We will help them out and guide them how to put the bare minimum required to do the Arabic in the label or in the SKU. Finally, it's very important that when in the label artwork, you put the disclaimer as well as the storage conditions. These are the tiny things, very important. And if the product is having some kind of animal derivatives, you will have to give a halal certificate. And if the product is allowed in some countries which are having some ingredient which is hazardous or could be carcinogenic, so UAE and the rest of the GCC are very, very particular about that, that we want the best in the world. So a manufacturer may have to remove such products, ingredients, as well as the claims they put on the label.
Understood. I think that's very exhaustive, and I can see that. I would say that this is all coming from practical experience. Thank you, Dr. Sanjay. Dr. Priyanka, I mean, of course, you're an entrepreneur. So is there anything that you have got? I mean, of course, Dr. Sanjay touched upon the certification elements and, getting your product registered and those aspects. But in your experience, have you seen any other challenges that generally, because, I mean, for us being an organizer of an exhibition, we get always interest from multiple companies, brands who want to get in. I'm sure like you would have in your entrepreneurial journey would have helped and advised many such brands, right? So other than the regulatory part of things, I mean, is there anything that stands out in your experience, Dr. Priyanka?
My experience would talk about this aspect as a practitioner, mostly because you're talking mostly about the product side of things and not services directly. So for products, we have been dealing mostly with registered providers only. So the moment they reach a practitioner, it's when they are already registered or are in the market. However, from my experience, of course, being here for more than a decade almost, regulatory compliances, as what Mr. Sanjay has very rightly pointed out, would be one of the biggest hiccups towards penetrating this market. And then the second thing that we feel, maybe it's very easy to come in the market and launch your product, but anything to do with wellness revolves around the trust factor. So building that brand equity and building that trust in the product is equally important to stay ahead of the game for anyone who wants to build the momentum for their businesses. So I think that is of essence. Maybe, that is something that would be required to look into once you already are in the market.
Absolutely. Can't agree more, because I know for sure there is another question later in the session, something which we will definitely address, the marketing element and branding element of it. I think within the market entry kind of a title, the next question that we have been asked was, how do health trends in the GCC, I mean, example, mainly to do with natural medicine, digital wellness, preventive care, compared to the global markets like Europe or Southeast Asia? I mean, it's more of a how do we compare ourselves in these areas, like kind of like a GCC versus rest of the world. Dr. Priyanka, if you could shed some light.
Speaking again from the perspective of as a wellness practitioner and also as a digital health entrepreneur, I think the health trends in the GCC have been in tandem with the rest of the world, has evolved very, very rapidly, especially echoing the global shifts while being uniquely shaped by the national vision programs within the UAE and also from Saudi Arabia, the rising consumer sophistication that we have seen of late, especially after the pandemic. Digital wellness, AI-enabled preventive care, bio-tracking technologies have also accelerated so much, underpinned by initiatives like the UAE's National Wellbeing Strategy, Saudi Arabia's Vision for 2030. I mean, these efforts are fast-tracking telemedicine providers, wearables, predictive health models into the mainstream. And it has become so much easier, also because of the easy deployment with the support of the authorities and local regulatory bodies. So simultaneously, I mean, the natural and holistic medicine is also gaining momentum, driven by both, driven mostly, I think, by the intrinsic affinity that this region always had towards the natural modalities and the healing modalities, the alternative medicine, et cetera, et cetera. So while Europe has established regulations and Southeast Asia has drawn long-standing traditional medicine systems, the GCC is now leapfrogging into integrated care models. So you can say that this part of the world has become the hotbed for the next generation hybrid model systems. We have the best of both the worlds. We bring the best of the South Asian, Indian, traditional Chinese medicine, Unani medicine, well-known, established holistic therapies, and the European and the American standard of digital, health and wellness platform as well.
Nice, good to know. I think that really brings let's bring in Dr. Sana into the discussion, because she's an expert from the traditional and complementary medicine. So Dr. Sana, question is more to do with traditional and alternative medicine integration into the current scenario. So the question goes, with increasing interest in Unani and other traditional medicine systems, how can global brands align their offering with regional cultural preferences, right? So it's more to do with, how do they align themselves with, the natural modalities and the cultural preferences?
See, first of all, halal certification is very much important. Before entering the market, every company should go through the ingredients they are having in their products. And apart from halal certification, alcohol-free is also in demand, and it gets the consumer, the end consumers' belief, or the credibility. Along with that, natural organic ingredients is a trend. So considering all these things, integrating the natural products in a more modern packaging is important. And the formula should be simple. Simple herbs should be used instead of complex formula. Making a product comprises 5, 10, or 15 products in one single brand, in one single product, it would not be accepted easily with the patients and with the consumers. Rather, if a single herb comes in a simple packaging, like in the form of a tablet, in the form of a capsule, it would be more accepted, easily accepted. And the second thing is, as being a practitioner, we prescribe medicines. The patient's first question the patient asks, is the product comes under insurance or not? So while registering a product with the ministry, the company should go for the registration with the MOH or DHA rather than the Dubai municipality. So when they register their product with the ministry, a doctor can prescribe a practice, and it might be reimbursed. So the benefit goes to the end consumer. So the other challenge is there are so many wellness products available in the market. So the companies have to check, or they have to target whether they want to reach directly to the patient, directly to the consumer, or they want their products to be prescribed by a practitioner, and then a person goes to a pharmacy and prescribe that. So there are completely separate regulations for these two areas. For Dubai municipality, it is comparatively easier, but with the MOH and DHA, definitely, because it comes under pharmaceutical, so the regulations are still stricter. But a brand to be successful, I would say that if they go through the practitioner's way, they have more confidence, because now the practitioner is prescribing a product. So the common man, rather than picking up any herbal product or wellness product directly from the aisle of a supermarket, they would be more confident to purchase that product from a pharmacy under a doctor's prescription. So these are the things. Other than that, cultural thing, herbal medicine and wellness products are very much in trend. So all my fellow participants, Dr. Sanjay and Dr. Priyanka, rightly pointed out all the relevant things which are there and what are the challenges for the companies. But only the thing which I wanted to add, that they should make a target consumer, like a common person is a consumer or a patient is a consumer of the product. So the strategy should be a little different. To keep in mind, there are so many alternative medicine practitioners, not only Unani medicine, but there are Ayurvedic, Chinese medicine, and all of them can prescribe, can reimburse the product. So this should be taken into mind while entering the GCC market.
Very interesting, Dr. Sana, because like what you rightly pointed out, right? Because there are probably like most of the streams of natural and alternative medicine streams are now available across GCC, especially in UAE, right? So generally speaking, what is the, how is GCC adapting themselves to accommodate these, nutraceuticals and other alternative therapies in general? What's the because we could see that there was an early wave in terms of I remember like when the market was open to natural therapies and alternative medicines. So how is that rate of growth, or how is that GCC governments generally adapting themselves into accommodating these?
This question is to me.
Yeah, if you could start off, then probably
yeah. See, they have already accommodated. They have already accommodated and already integrated the alternative medicine into the mainstream. We have all the practitioners working in polyclinics where already allopathic medicine is there. All the big hospitals and clinics, multi-speciality clinic, all the integration has always had already been done long back. And now the patients are really aware of the alternative medicines and things which are available in multiple clinics. Only the thing is that I think the manufacturers have yet to start to build a relation between them and the practitioners. The patients, the consumers have already established a relation. They come to the clinic, they go for the alternative therapies, whether it is cupping therapy, whether it is massage, whether it is a different ozone therapy or hydro. There are so many, Chinese therapy, acupuncture, and all of them are entitled. Whoever has a license as a physician, they are entitled to prescribe a medicine, and that medicine will come under insurance, will be reimbursed. So the regulatory departments, the ministries, have done a tremendous job, have really done a very good job in integrating the alternative therapies like hijama and other lifestyle modalities. But the thing is that the companies yet to establish a relationship. I think that they lack in this thing. They just directly enter into the market without considering that there could be a mediator between them and the end consumer. And that are we are the physicians, we are the mediators. If they go through if they establish a one channel through us also, it will benefit them, it will boost their business.
Okay, understood. Perfect point, Dr. Sana, because so what you're saying is there is a need for the brands and manufacturers to get involved, be more visible, to educate the market, work very closely with physicians so that, you've got, let's say, consumers / patients, that market is ready for that adoption. Governments are ready in terms of, getting acceptance, regulatory framework, all of that is ready.
Yes.
Of course, there is a need for these brands and manufacturers to get more involved. Yeah. Is that the same opinion that you have got, Dr. Priyanka, as well?
Yes, absolutely. Dr. Sana has very rightly put in. Just few more words to add there is that, see, I mean, GCC region, especially the UAE, has been instrumental into providing the traditional and alternative medicine care to its population. And in order to do that in a most robust manner, they have made sure that regulatory authorities handpick only the best of the best healthcare practitioners. They have established the framework of licensing and providing the authority to practice in this part of the world in the right manner, within the right channel. So that was established 2 decades back almost. So that has always been there. Now, with more digitalization happening in this space, we're talking about having interoperable systems. We need interoperable systems. Why? Because we want the patients and the providers both to have the transparency, for the patients to have all their reports together under one roof, to know exactly historically what has been, provided or prescribed. And so whenever they go or move to any other practitioner, they carry their historical data with them, providing the same transparency again to the next provider, healthcare provider. And that really builds the trust in the infrastructure for the patients, for the population. What I love about, our authorities is how seamlessly they're integrating the alternative medicine as well into the interoperable system. Whether you talk about NABED or this and that, whatever that is now being implemented, the training, the onboarding has been done equally for everyone without any unbiased, opinions. So just how a conservative conventional practitioners are being onboarded to make that system robust, so are the doctors and physicians and providers of alternative medicine as well. And this is really true, I would say, foresightedness for government authorities moving forward. And this really also highlights how promising this part of the world is for our stream of practice and the digital health as well.
Yeah, I really endorse the things which you have mentioned. The NABID system, you would be surprised that all the registered alternative medicines that are present in UAE market, all are there in the NABID system, and we just have to pick and choose and write the required dosage, and that's it. Everything is digitalized, and Alhamdulillah, that's a wonderful job that the authorities have done to integrate the alternative medicine along with the modern medicine. This is really a commendable job.
Agreed.
I agree with you both. I would like to add something. So, Dr. Sana, you are spot on, as well as Dr. Priyanka. I will narrate a tiny example. A person took some herbal medicine, and because his friend had recommended, and the gentleman lost both of his kidneys. So it is very fatal sometimes that the patient do self-medication. So they need a qualified doctors and the therapist who can guide them through. And that's why in the UAE, in particular, because me being in the regulatory for the GCC, I find that every product has to be properly made a dossier, and we have to also give the bioequivalence studies and a lot of other paperwork for the product to be 100% is easy for the consumer to consume. So this I would like to add. The Dr. Sana, as you said, has to go through a proper practitioner who can recommend the product which is already registered, and then they can be given from the pharmacy or elsewhere.
Yeah.
Yeah, I think that that's absolutely a given, right? I mean, that really brings into the next question, which is because we have been listening, we understand that, the market is ready, or the consumers, there is demand. So, some of them want to know what factors are driving these consumer shift towards organic and healthy lifestyle, so to speak, wellness products, right? Is it price? Is it lifestyle? Or is it awareness? So, what is that major factor that is making the shift? Because like you all said, you all agreed that, okay, you know what, the consumers are ready, the market is ready. So what is that driving factor or force?
So let me begin with that, if you allow me. People are now more educated, and they know that with the natural medicines or organic products could be free from any side effects. That's the first factor. Second is a lot of research has been done under the botanical or other plants, which they find out that yes, the products are far more with lesser side effects and no contraindication, and they can safely take. Like myself, have hired a scientist in California who are doing more research on the aloe vera, and I found there is a fantastic result with this natural herb. Uh, as an example, I would like to set. Similarly, there are a lot of such herbs. There's a lot of research is going on, and certainly the people are aware, general public, because now they have been bombarded with a good quality of the research and also being lesser side effects and more awareness.
Okay.
I would like to say, yes, definitely the awareness is one thing. And the second thing is being healthy is trendy nowadays. Everybody is cautious about their health. Like back 10 years back, nobody thinks of what they are eating, what they are consuming, how well they are, how physically fit they are. But nowadays, it's a trendy thing. Everybody to being healthy, everybody wants to be fit. So this is the best phase alternative medicine and wellness products are enjoying. And I think UA is in its boom. So definitely the companies should come and get benefited from this environment where everybody is educated, everybody knows the things. But pricing is definitely a factor which can turn off the consumer, because whenever herbal products, when it comes to organic things, the pricing goes too high. So they cannot continue the product. Once in a while they can buy the product, they can try it, maybe they get benefited also, but to keep the things in their lifestyle, to consume the things occasionally, it becomes a hurdle. The pricing should be moderate and it should be relevant. It should be not too high.
So competitive pricing, that's a good point. Yeah, Dr. Priyanka.
I would just add a few things, because both my co-panelists have very rightly put everything mostly here together. But I think inevitably the pandemic really catalyzed a long-term interest in finding long-term preventive solution as well. There was a definitive, inevitable mindset shift that we saw. And speaking from my, again, personal experience, in patients' perspective also, I have seen that shift. So trying to just fix the problem, they want to now go down to the root cause of the problem, which was there before as well, but not for this kind of larger percentage of the population that now we see are interested in finding that long-term preventive solution. So that has really catalyzed that paradigm shift in their approach. Now, of course, when it comes to what is resulting in the decision making while choosing the products, the organic products, so and so forth, definitely is the awareness. Everything is so information heavy these days. I would not call it noise, but there's just so much information flowing in and out every day from social media here and there. So people are quite, say, edgy to make sure that they are ahead of the game, ahead of the curve in terms of managing their longevity and making sure that the quality of life in the later years are up to the mark. So now is the time for alternative medicine, organic, products, etc., as what Dr. Sana very rightly said, to make it cost effective for best adaptation and sustainability as well. That's it.
Perfectly put together by all three of you. I think, one thing which kept on coming was like, preventive cure, immune boosters. So which categories, in your experience, which of the wellness categories like supplements or functional or natural skincare, which of these elements or which of these sectors are currently showing fast growth in this region?
So I would like to add quickly.
Yeah.
Collagen is now very much in, along with that hyaluronic acid. Apart from that, a part of aloe vera into the local application form is also trending.
Okay, so is that more into the skincare part of it, or the collagen, aloe vera, all of that?
Yeah, so collagen is mainly into the skincare part of it, as well as aloe vera both. It helps if taken ingested, then it can help you to reduce weight, control your sugar, stop your hair fall. Whereas if you use it as an local applicant, is also useful to have a better younger skin, lesser wrinkles, and also heals the wound fast.
Okay.
Similarly, with hyaluronic acid, predominantly it is used for people who are having aging problem like walking or osteoarthritis, etc. Apart from that, hyaluronic acid is also used sometimes in different facial therapies.
Okay, great. So that's more rounded around, people getting more concerned about skincare and that kind of thing. Is that what you see, Dr. Priyanka, as well?
I would say most of the time we see patients coming in for a lot of gut health conditions. Now,
Okay.
when we focus on gut health, so when your gut is healthy, a lot of other systemic support also revives any other health concerns. So the
Mhm.
root cause might be in your gut. So that causes the inflammation, and then things starts to kind of go into that vicious cycle altogether. So we're talking about gut being the core of building the inflammatory changes in the body. And so I see a lot of allergic cases, allergies, eczema, psoriasis, seborrheic dermatitis, inflammatory bowel diseases, chronic fatigue syndromes. I mean, you name it. And there are these conditions that are evolving because of the poor digestive health, which can then start because of, again, I can give you hundreds of different reasons why it would start. There could be just chronic stress driving this. It could be just poor dietary habits driving this. It could be poor sleep driving this. And this part of the world being 92% of expatriate dense population, you can imagine work is so central that people do fall in this pit hole, not giving the attention to the areas of health. So for me, I would, really look at gut health and any product that can revive gut health, reduce inflammation, support to reduce, the pro-inflammatories in the body would be, a physician's best friend over here in this part of the world. Yeah.
Very interesting. So we have got skincare and we have got, of course, gut health, which is always discussed. And what is it that you witness, Dr. Sana?
See, I have seen that all the categories which you have mentioned, like supplements, beverages, or skincare, they are really doing very well, and they are in trend. All these categories, and which Dr. Priyanka said that any anti-inflammatory things, it would be acceptable, and really it would do a good thing. But for me, I think one category is lagging behind is the hair care. Nowadays, people are having hair fall and dandruff and skin problems, and the market is flooded with the products that are basically chemical based. Herbal products are lagging behind, and even if they have herbal products in hair care category, that are mixed with the chemicals. So we as a practitioner, we want simple hair care products like simple herbs, simple oils, simple packs, which come into the market, and we write, and the patient can go and purchase it. Sometimes the patients ask doctor which kind of shampoo or which kind of supplement should we take for hair care, and we really wanted to write, but they are not commercially available in the market. So what we tell them, just go to an herbal shop, get this herb into a powder form and consume it, or take it in the form of tea or oil, get the oil from the home country, because it is not available or registered. And these are very simple things, like the amla oil is very simple product, but it's excellent in for hair follicles, for hair growth, and many other problems related to hair and scalp. But it is not available easily. It is not available. I have seen that, and even if it is available, it is mixed with certain other oils. So that this is area, I think the companies should focus, if they are bringing organic and herbal products into the market with less chemicals, with less parabens, no SLS, and no other chemicals, only simple pure herbs in the form of capsules or tablets or oils for the hair. That I would suggest.
Great, thank you. I'm sure, we have got many suppliers or brands, who are into hair care and they're all listening. Sorry, Dr. Priyanka, you wanted to add something?
I was just saying that I second Dr. Sana's, viewpoint here, that we do definitely lack one robust, these kind of products, and we have faced similar challenges as well with patients. Yeah.
Interesting. So I think next we have got two more kind of like sectors or subjects that we spoke about, and that brings us to more in terms of digital channels and use of digital channels in retailing, right? So I mean, I think probably we are referring more to over the counter that kind of retailing here. So the question is, how can brands best leverage digital platforms and e-commerce to reach health-conscious consumers in the GCC? Are local partners necessary? So I know that probably part of that is already being discussed about the importance of having a local partner. But I think, Dr. Priyanka, because you have got, Huga and other initiatives, so probably we'll start with you. So what is your take on how can brands leverage these e-commerce and, other retail channels?
I think, I mean, with social media penetration exceeding 95%, platforms like Instagram, TikTok, and WhatsApp, which are no longer just discovery tool, but they are quite robust commercial channels as well. E-commerce in this region is projected to surpass, I would say, almost 50 billion US dollars of business by 2029. So with wellness and health products forming such fast growing sub-segment, partnering with local providers, partnering with local existing players, in even partnering with the digital players who are the local digital delivery partners, for example, or even digital health engagement providers like Huga, who is closely working with insurance companies and organizations. And we have users engaging with such platforms on a day-to-day basis to be exposed to such other partner solutions or products would build immediately the market penetration for anyone who wants to roll into this market and build again the business momentum as soon as possible. So this would be my 2 cents. Local partnerships are critical, whether with digital health platforms or licensed clinics, or you curate your own wellness niche market providers, and as they accelerate trust, regulatory navigations, obviously it adds to your operational efficiency to quickly gain your market share and brand equity as well.
Absolutely. Dr. Sanjay, from your experience, is that again that you see, especially from your background in pharmacy and some of the regulatory aspects. So what are the best tools, or like how important, how can they utilize the existing channels, especially when it comes to retailing to consumers?
True. So we need a local partner for many reasons. A company from across, or I will call it a principal, may not like to invest initially in the logistic part and also in the marketing or in the place of storage. So there where a local partner comes very handy for the success of their brand to be put in different shelves, and by doing so, they can increase their accessibility, visibility, and eventually the sale. So suppose Dr. Priyanka or Dr. Sana or that many good practitioners, they want to prescribe a product for somebody, and as she said that you don't get the best product sometimes. So a local partner can always play a very important role in making the logistic part in the operation locally.
Very, 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 very valid point. Yeah. Dr. Sana, anything to add?
See, local partnership is not necessary, but yes, it is extremely important in today's environment. It is really very important step. It gives the very important initial boost that every business is looking for nowadays. So I would really say that if any company is entering into the UAE market, they should go for a local partnership.
And I would like to add something more. Yeah. If you allow me, I'm sorry. Regarding the e-commerce or the people buying across, like, the product is sometime available in, say, in Northern America or in the Europe, where it is easy to get access to. You are in the UAE, maybe there is a ban ingredients and they try to bring it in, then at the custom that may stop. So it's always better to buy locally when it's recommended by some qualified DHA, qualified practitioners, would be very safe for the local consumers.
Absolutely. So I think it's pretty well known, and this is what, again, year after year, that's exactly what we see on the floor at the expo. That every time that having that local partner, whether it's a importer, distributor, wholesaler, trader, whatever you call them, they become like an extended eyes and ears for the brand in the local market. So I think that's when probably like I will couple that with the next question, the importance of localization, right? So what they mean by localization is in branding, in language, in packaging, in ingredients. So is there any kind of advice, any tips that any of you want to share in terms of, for these brands, how important is localization and yeah, to be successful basically in their launch?
I would like to add one thing, if you allow me.
Sure.
The packaging, I would say that definitely language is important. It should be bilingual. It should be English as well as Arabic. And the second thing is packaging. My patients, which I have felt that they really want simple products. They want simple oils. They want simple herbs. They want simple packaging, like in the form of teas. If I go like herbs, if they want to take single herbs, they want to take in the form of tea. If they want 2 or 3 herbs, they want to take in the form of powder or oils or anything. So not very sophisticated kind of packaging, having all the long list of ingredients, along with that preservatives, along with that color components, along with that fragrances. No, they would go for, if 2 products are available at the same time. My patients, as far as I know, they are local Emiratis, and they would prefer the simple product which is available, whether it doesn't have any glates or outer attractiveness, whether it doesn't matter to them. They would go for the simple thing, only 1 or 2 ingredients written on it, and that's it. So packaging is very, very important. I don't know about European or Western markets, but here the UAE market is like this. The locals, they love herbs. They love to take herbs in the raw form rather than highly processed form. They don't want excessive processing. Simple form is fine to them.
Great. So Dr. Sana is saying, keep it simple, one at a time. So is that what you see, Dr. Priyanka?
Similar to that as well. Obviously, simplicity is the best approach. Also, just a quick one on that, what Dr. Sana said is that when you're using a product with multiple ingredients, and if something goes wrong, you don't really know which ingredient did that to you. And one of the other ingredients could actually be quite potential to bring the relief for the patient. So it's sometimes it just goes amiss if we are having too many ingredients in one, particular product. I feel like it's better to have a number of ingredients in one product. Having said that, going back to your question about localization and what are the tips that I would like to give, I think if you really want to come into this market, and if you have a product or you have a service, I think you should begin by understanding first the market. Expos, for example, or such exhibitions really give you that quick market access. So you understand and you gauge with, at a glance. You build, networkings and partnerships quickly. You get very quick access to the market, and you might even get, introductions with the market leaders and collaborations with the, regional leading wellness providers, clinics, digital health platforms, key advocates, influencers, enablers. These partnerships really help with that market access you need to, survive in this competitive landscape. As much as it is promising in this GCC region to thrive, that much of competitiveness you have to cut through, and hence these would be really, really helpful to look at. And of course, understand your compliance requirements around whatever that you're doing. If you're a digital product, then understand the GDPR and the HIPAAs and all those sort of things to make sure you meet the basic digital health compliance requirements. If you're a product, then understanding your halal certification, therapeutic claims, and so on and so forth. Make sure you don't have any hiccups even before you have launched.
Interesting, Dr. Priyanka, that you mentioned about exhibitions and events as leveraging them to when it comes to launching a product, right? So I just want to know, wanted to get the feedback from other panelists as well in terms of like let's say to create that trust and be among the right people. So is that what are the platforms, or like do you think that like expos, events, and whether online platforms, do they help in building that credibility and fast tracking that market entry? I mean, especially when it comes to wellness products. So, Dr. Sana, maybe.
Yeah, I would say that really these expos and events are really important. They build credibility among the consumers. They rely on the events because these events have been licensed by the authorities. So they have the backing of the authorities. So the first step has been done. The consumer already know that the event is backed, and the participants are already known, are already being tested by the authorities, and that's why they have been given the license to promote their things. So the first step, the first hindrance is not there. And the second thing is really the marketing and other promotions, but definitely events and expos are the first steps to enter the GCC market.
Interesting. I mean, Dr. Sanjay, is that something that you use? Do you use these kind of platforms in your, whether it is sourcing, whether it is keeping yourself abreast, whether it is to know more what's happening generally around the industry? Is that something that you do as well?
Yes, I very much do. First, let me take you to the question before the one that is regarding the labeling of the product is very important. Like Dr. Sana said, fewer ingredient could really be very easy and for the consumer to understand instead of having a complex product. So that's a very important part. And in the label, one should mention in Arabic as well as in English is definitely good for the consumer because they read and they say, yeah, this is the right product for me. Now coming to the point, yes, for me, all the events like the exhibitions we have is very, very, very important for the many reasons. Like for example, you want to source something from Thailand, something from Vietnam, and maybe something from elsewhere. You may not be able to, or you wouldn't like to travel to all those countries. So the platform like the Organic or other company, this Arab Health and so on and so forth, they do the exhibition here. So we get all the manufacturer and the networking, and we see a lot of competition, good products in the market right at the UAE or in the GCC. So yes, such kind of exhibition is a must for the better development of the products and better health and the wellness of the end consumer.
Interesting. I think they also like, these conferences and sessions that held along. I mean, I think, to partly like, what we all discussed about, educating the market, whether it is, the physicians who is their, go-to person when it comes to reaching or, opening up a new market. And largely speaking, I mean, of course, once you empower the physicians and, pharmacists, I think that's when, like they will do that marketing part for your brand, right? Eventually. So I think that kind of like brings that networking and branding and market presence, that part of that section into a closure. So I think I can imagine that how can we be so bang on time? We are 3:55. So I think. The last, I think, before we say thank you and goodbye for today, I just wanted to ask each one of you, because of course, we discussed various elements, various areas of market entry, and whether it is product development, whether it is regulations, all of that. So I think I would really appreciate if you could give 2 to 3 actionable steps for new brands who are considering GCC for the first time. What are those steps that you would recommend? As a beginning of their journey, or what they should be considering now?
I think I'll go first. So
Yeah.
I think being an entrepreneur, it has been so painful for me as well, because as an entrepreneur, you start and you start from scratch, understanding a new market. It's very daunting, as you can understand. So understanding what kind of consumer personas are you targeting, really, really, to understand that first. So try and do your, homework, understand what personas you want to target, first of all. Are you trying to target a certain consumer strata who can, pay any kind of premium products? Because then your marketing approach would be different. Your partners are different. You want to speak the different language. The way you package yourself, you're differently packaged. Everything is different. If you want to keep it traditional, if you want to keep it clinical, if you want to just cater to that strata, then your whole approach is going to be very different. So that would be my first-hand approach. I have seen two companies, I don't want to take the names, two companies. One is it's an electrolyte drink, and the other one is a gut health probiotic supplement. That's it. That's all they do. And they really, build that brand narration so beautifully. I can't tell you the way they crafted it. And when I saw them for the first time, the first instance, I knew that they're going to be a hit. And I didn't even have to. Now, the next thing I know, after 5 years, is everyone's using it.
Right.
So you really have to do that.
Runaway success, yeah.
Absolutely.
Very, very valid points. I think basically that product fit in terms of which consumer, which sector, the persona is very, very important. Thank you very much for that, Dr. Priyanka. How about Dr. Sana?
See, I agree with Dr. Priyanka, but I would like to add one more thing, that they have to divide the consumers horizontally and vertically. So in one section, they have to see the pricing thing, upper class, middle class, and lower class, the paying capacity. And in the other section, they have to categorize the consumer into gym goers or patients or cosmetic industry or wellness or supplements. So in these two categorization, they can target the really, they stick the bullseye. They will stuck, inshallah, and they will get the success in that. But they have to do a lot of research in that. And the second thing comes up when they are done with this categorization, then they come with the licensing and regulations. There are many products, there are many ingredients that are banned, that are restricted, that for that you have to take special approvals that cannot, there are some products which are approved, but they are only approved in certain forms that cannot be, that can only external applications, internally that cannot be consumed. So the companies, that this is the second step. And the third step is that competitors and pricing. When they target that this is their target audience, then they have to see how many local competitors are available, because nowadays UAE market is saturated with health and wellness products. All the categories have one or two or more forms available, easily available, whether it's in pharmacy, whether it's in supermarket. So these three things: first, categorization; the second thing is licensing; and the third thing is competition and pricing. These three things the companies should take in mind before entering the GCC market.
Very interesting. I've started writing because I will shortly come up with some kind of a 101 on how to enter the market. You have been really really brilliant when it comes to giving that advice away. I'm 100% sure that people who are on the other side, who are attending and listening to us, and even later, I think they will be very, very thankful to all my panelists, and of course, Dr. Sanjay. What's your tips to these clients?
Dr. Priyanka and Dr. Sana just said everything spot on. A few more things I would like to add. First is newcomers should start something very humbly. Get all your products properly documented, legalize them, register them, do a tiny market survey, see what the competitors are doing, what is your benefit better than them, and then you can launch them humbly. Once you are at that level, having 10 consumer will definitely multiply into hundreds and thousands. So yes, I agree with both the panelists regarding what they said about doing the launch and the process of getting the product into the UAE or into the GCC.
Perfect. That has been pure words of wisdom. I'm saying this from the bottom of my heart because I know that these are the kind of information, advice that generally you don't get out there, right? I mean, how many ever, books you read or, marketing or strategies or whatnot, nothing that can beat on the ground, real time information and advice. So that's exactly what you have been sharing with our audience for the last 1 hour. So I'm really grateful to all of you for that. So with that, I think we have come to an end. So it was a pleasure having all of you, I mean, including our attendees, to join us for today's health and wellness focus session of Organic Majlis. Heartfelt thank you to our insightful speakers, doctors, for sharing their expertise, and to our engaged attendees for being part of the meaningful conversation. To wrap up, today's session shed light on how the GCC health and wellness market is undergoing a rapid transformation driven by growing demand for natural supplements, traditional medicine, clean label products, and much more. Consumers are increasingly prioritizing preventive health, immune support, and holistic wellness, creating real opportunities for brands that offer authentic, science-backed solutions. Of course, there are much more than this that we discussed, but I'm sure like they all have had their own fair share of takeaways. We invite all of you to continue this important dialogue and be part of the Organic and Natural Product Expo taking place from 17 to 19 this November at the Dubai World Trade Center. So let's build the future of wellness together, along with the brands and manufacturers together. If you would like to know more about the event or have any questions related to today's session, feel free to reach us. You can write to us on info@organicandnatural.com. And of course, our team will be happy to assist. Thank you once again and have a healthy, wonderful day ahead. Thank you so much to all of you.
Thank you for having us.
Thank you.
Thank you so much.